Cancer almost never kills you by being cancer. It kills you by taking something you need and refusing to give it back. A lung that can no longer move air. A liver that can no longer clean your blood. A spine that can no longer hold you up. Every cancer on this list has its own way of doing that, and understanding those ways tells you far more than a survival percentage ever will. Lung cancer kills more people than any other cancer on Earth, and the reason is buried in the anatomy. The inside of your lungs has no pain receptors. A tumor can reach the size of a lemon in there, and you will not feel a thing. What people eventually notice is a cough that never resolves, or blood in what they cough up, and by then, the disease has usually already left the chest. It leaves easily. Lung tissue is a dense mesh of blood and lymph vessels, essentially a transport network, with a tumor sitting in the middle of it. Cancer cells step onto that network and get carried to the brain, where they cause headaches, seizures, and personality changes that families often mistake for stress. They travel to the spine, where they eat through vertebrae until a bone snaps under the weight of ordinary standing. Small cell lung cancer is the aggressive variant, capable of doubling its mass in under a month, and it is the one most tightly bound to smoking. Immunotherapy has genuinely changed outcomes for some patients, but for advanced disease, the 5-year survival remains in the low single digits. A great many patients die not from the lung tumor itself, but from pressure building inside the skull as brain metastases swell. Pancreatic cancer is the one oncologists fear on their own behalf. Roughly 1 person in 10 is alive 5 years after diagnosis. The pancreas sits deep behind the stomach, cushioned and hidden, with nothing important pressing against it. A tumor can reach golf ball size before it disturbs anything. When symptoms finally arrive, they are almost insultingly vague. Yellowing skin, dark urine, a dull ache in the back, weight falling off for no reason. By that point, the liver is usually already involved. Even the patients caught early enough for surgery face an operation so complex it takes hours and reroutes the digestive tract. And 4 out of 5 will see the cancer return within 2 years anyway. Part of what makes it so untreatable is physical. The tumor builds a thick shell of fibrous scar tissue around itself, and chemotherapy drugs cannot reach through it. Nearly all pancreatic tumors carry a mutation in a gene called CRAS, which drives relentless growth and blunts most treatments. And the cancer thickens the blood. 1 patient in 4 develops a clot, and a clot that reaches the lungs can kill in minutes. Liver cancer has a peculiar cruelty, which is that the organ is usually already dying before the tumor appears. It grows in livers scarred by hepatitis, by years of alcohol, or by fatty liver disease, and many patients die from that underlying scarring rather than from the cancer. A person with a small tumor can bleed to death from swollen veins in the esophagus that rupture without warning. They can develop a severe infection in the fluid that pools in the abdomen. They can slip into a coma because a failing liver cannot clear ammonia from the blood, and ammonia poisons the brain. The tumor itself likes to invade the large vein carrying blood from the intestines, which sends pressure backwards and floods the belly with fluid fast enough to make breathing difficult. In about 1 in 10 patients with large tumors, the mass simply ruptures and bleeds into the abdominal cavity. Half of those people die before they reach a hospital. Esophageal cancer takes away swallowing. The tube from your throat to your stomach is muscular and stretchy, so it accommodates a growing tumor for a long time before you notice. The first sign is usually food catching on the way down, then soft food catches, then liquids. People lose enormous amounts of weight in a short window, not because the cancer is consuming them, but because they physically cannot get calories past the blockage. The esophagus sits pressed against the aorta, the windpipe, and the nerves controlling the voice box, and a tumor that grows outward can invade any of them. When it erodes into the airway, it creates an open channel between food pipe and lung, so every swallow drips into the lungs and causes pneumonia. When it erodes into a major vessel, the bleeding is catastrophic and fast. Stomach cancer is common across much of Asia and South America, and rising in younger adults elsewhere. Early symptoms are indistinguishable from indigestion, which is why so many people take antacids for a year before anyone looks inside. One form, called linitis plastica, does not grow as a lump at all. It spreads flat through the stomach wall, turning the whole organ stiff and leathery, so it stops stretching to hold food. The stomach can look almost normal on a scan while being functionally dead. Stomach cancer also has a habit of shedding cells directly into the abdominal cavity, where they coat the lining of the intestines and cause fluid to accumulate. Once that happens, the disease is essentially spread throughout the abdomen rather than located anywhere a surgeon can cut. Colorectal cancer begins as a polyp, a small growth on the wall of the bowel, and takes years to turn malignant. That slowness is why screening works so well, and why the cases that kill are usually the ones nobody screened for. A tumor on the right side of the colon can reach the size of a fist without changing your bowel habits at all, because that section of the bowel is wide and the stool passing through it is liquid. The first clue is often fatigue, caused by slow, invisible blood loss draining your iron. All blood from the colon flows straight to the liver, so that is where the cancer lands first, and liver metastases are the usual cause of death. There is also the risk of the tumor eating clean through the bowel wall, which spills bacteria into the abdominal cavity and causes an infection that can kill within a day. Glioblastoma is the most common aggressive brain cancer in adults, and it is currently incurable. Median survival is somewhere between 12 and 18 months. What makes it untreatable is that it does not form a discrete ball you can remove. It sends tendrils of cancer cells microscopically through healthy brain tissue, sometimes crossing to the opposite hemisphere, so even a surgeon who removes everything visible on the scan has left cancer behind by definition. There is no margin to cut. As it grows, it destroys whichever function that part of the brain performed, so patients lose speech, or the use of one side of the body, or the ability to recognize the people they love. The skull cannot expand, so swelling around the tumor raises pressure until consciousness fades. Most people die quite peacefully, asleep, which is the one mercy in the whole disease. Ovarian cancer is the one that hides in plain sight. The ovaries sit loose in the pelvis with room around them, so a tumor grows without pressing on anything. The symptoms are bloating, feeling full quickly, and needing to urinate more often, which describes half the adult population on any given week. That is why roughly 3/4 of cases are diagnosed after the cancer has already seeded the abdominal cavity. Once it does, it behaves less like a tumor and more like a dusting of cancer across every surface in the abdomen, coating the intestines and the diaphragm. Fluid accumulates until the abdomen is visibly swollen. The usual cause of death is bowel obstruction, where the intestines become so wrapped in tumor that nothing can pass through them and the patient can no longer eat. Acute leukemia is the cancer that is everywhere from the first day. It arises in the bone marrow where blood is manufactured, and it fills that space with useless white cells that crowd out everything functional. Patients lose red cells, so they cannot climb stairs. They lose functional white cells, so a minor infection becomes fatal sepsis in hours. They lose platelets, so a nosebleed will not stop, and brushing teeth causes bleeding. This can develop over weeks. Somebody feels tired at the start of a month and is in intensive care by the end of it. The treatment is brutal by necessity, because it must kill every dividing cell in the marrow, and for several weeks afterwards the patient has effectively no immune system at all. Ordinary mold spores in ordinary air can cause fatal lung infections during that window. Around 1 in 10 patients dies from the treatment rather than the disease. Aggressive lymphomas are cancers of the lymph nodes, which exist throughout the body, so they can cause trouble anywhere. Someone notices a painless lump in the neck that is noticeably larger a fortnight later. Within months, the disease can reach the bone marrow and reproduce all the problems of leukemia, or invade the liver, or cross into the brain. Burkitt lymphoma is the fastest-growing human tumor known, capable of doubling in a single day. Its speed creates a strange danger during treatment. When chemotherapy hits, the cells die so fast and in such volume that they flood the bloodstream with their own contents. overwhelming the kidneys and disrupting the electrical rhythm of the heart. That is tumor lysis syndrome, and it can kill a patient whose cancer is responding beautifully. Hodgkin lymphoma is the opposite story, usually curable even when found late, but chest radiation raises the risk of breast cancer, lung cancer, and heart attacks decades afterwards. Some survivors are treated in their 20s and face the consequences in their 50s. Melanoma is skin cancer that has learned to travel. It can begin as a dark spot no larger than a pencil eraser, and for as long as it stays in the surface layer, it is essentially harmless and curable by excision. Once it grows deeper than a few millimeters, it reaches blood and lymph vessels, and everything changes. Melanoma has an unusual affinity for the brain, reaching it in more than half of patients with advanced disease. Those brain tumors bleed easily. A patient can feel entirely well on a Tuesday and be unconscious on a Wednesday from bleeding inside the skull. Immunotherapy transformed this disease within a decade, taking it from almost universally fatal to durably controlled in a substantial fraction of patients. But the drugs work by removing the brakes from the immune system, and an unbraked immune system sometimes attacks the colon until it perforates, or the lungs until they fail, or the heart muscle itself. Triple-negative breast cancer is the most dangerous common form of the most common cancer in women. Most breast cancers are fed by hormones, which means they can be starved by drugs that block those hormones. Triple-negative tumors have none of those receptors, so there is nothing to block. They grow fast, and they favor the lungs, liver, and brain. Inflammatory breast cancer is rarer and stranger, producing no lump at all. The breast turns red, hot, and swollen, and doctors frequently treat it as an infection for weeks, while the cancer spreads through the lymph vessels of the skin. Breast cancer is also notorious for returning late. Women treated 15 or 20 years ago can find it back in their bones, causing severe pain, dangerously high blood calcium, and vertebrae weak enough to collapse onto the spinal cord. Prostate cancer is the paradox on this list. Enormous numbers of men have it and will die decades later of something else entirely, which is why treatment decisions are genuinely difficult. But the aggressive form goes almost exclusively to bone, and it does something unusual there. Most cancers dissolve bone. Prostate cancer builds new bone, abnormal and weak and painfully dense. It takes over the marrow, so patients lose blood cell production. It grows in the vertebrae until the spinal cord is compressed, which causes paralysis from that level down, and is one of the few true emergencies in oncology, because the window to preserve walking is measured in hours. The main treatment removes testosterone, which the cancer depends on, and it works for years. Then the cancer adapts and stops caring. And from that point, survival is usually measured in months rather than years. Kidney cancer is frequently found by accident, discovered on a scan ordered for something completely unrelated, because you have two kidneys, and one of them can be substantially destroyed before your blood tests notice. The classic textbook warning signs of blood in the urine, flank pain, and a palpable mass almost never appear together, and when they do, the disease is usually advanced. Kidney tumors have a particular habit that few other cancers share. They grow directly into the large vein draining the kidney and can extend up that vein as a solid column, sometimes all the way into the heart. Fragments can break off and lodge in the lungs. The cancer also ignores chemotherapy almost entirely, which is why treatment relies on surgery and on newer drugs that cut off the tumor's blood supply or unleash the immune system against it. Mesothelioma sits slightly apart because it is almost entirely man-made. It grows in the lining of the lungs, and it is caused by asbestos, usually inhaled 30 or 40 years before diagnosis. It does not form a tumor so much as a rind, thickening around the lung and slowly squeezing it until it cannot inflate. Patients describe the sensation as being progressively compressed. Because it wraps rather than clusters, there is no clean operation, and treatment mostly buys time and comfort. Cholangiocarcinoma, cancer of the bile ducts, is the last of the truly quiet killers. The ducts are narrow tubes, draining bile from the liver into the intestine, and a tumor blocks them. Bile backs up into the blood, which turns the skin and eyes yellow and causes an itch so severe that patients scratch themselves raw. Stagnant blocked bile becomes infected easily, and that infection can go septic within hours. Most cases are found only once the blockage is complete, and by then surgery is rarely possible. What links every disease here is not aggression but concealment. Almost none of them hurt early, because pain requires nerve endings and most internal organs have very few. The cancers that kill are the ones that grow in places with room to grow and no way to complain. That is also the entire logic behind screening. A colonoscopy, a mammogram, a low-dose CT for long-term smokers, a check on a mole that has changed shape. None of them find cancer at the moment it becomes dangerous. They find it during the silent years before it does.